Hi there, my name is Rosemary Vandervan and I'm currently attending Davenport University right now. And my class that I'm attending for this video is in regards to healthcare law and ethics and end-of-life patient dilemmas. As far as when people have terminal diseases where they're really suffering, I feel that it should be up to them to decide what they wish to do with their life. After all, my life is my life, and I'm sure your life is your life, so you should be able to decide what you want to do. I mean, would I personally do it? I'm not sure. I'm not in that situation right now. If I were terminally ill, I think I would try to suffer my way through it, and I would think that if it got to the really bad part where all I felt was pain and I could barely breathe or talk, or even if I was at that point where I was brain dead, I would want to have the ability where I could have the option to let myself go peacefully and without being in pain. I did some little bit of research on this, and typically people come up with the idea of euthanasia as like you think about putting your pet under when they're caused by some sort of disease or has a serious injury. And it basically means the Doctors Act will administer a life-ending dose of medication to cause the pet or the person's death. Euthanasia is actually from a Greek word, eu and thanatos, which means good death, means killing a person because you do it out of mercy and a misplaced compassion. And I found this information on Catholic National News Journal, so that helped a little bit with finding some information out. And it used to be that people would give soldiers in the war morphine, especially if they were going to do a surgery or they just wanted the person to be put out of their misery. They would sometimes inject them with certain medications like morphine, which would stop the breathing or the ability to breathe. And after World War II, I was reading that because of World War II, people figured out what the Nazis were doing during the Holocaust. And that started from a Nazi euthanasia program, which is pretty astonishing. The killings took place from September 1939 until the end of the war. And then approximately 300,000 people were killed from psychiatric hospitals in Germany and Austria. During that time, the Nazi government was creating propaganda to promote euthanasia-assisted suicides too. So everybody knows what went on over in Germany. I found this information on www.catholic.com, and it's an article called The Secret History of Euthanasia and Assisted Suicide by Trent Horn, and it was written 3/31 of 2020. So it's kind of alarming when you think about that's what euthanasia, how it became so well known. And then when you think about the word suicide, it sounds kind of scary. It also sounds like it's kind of illegal. The Roman Catholic Church is harshly against suicide in any way, shape, or form. But people suffering from terminal illness and the contemplation of assisted suicide or death by choice sounds comforting. And back in 1997, the first state that was able to become legalized for physician-assisted suicide was Oregon. It's now legal in California, Colorado, Hawaii, Maine, Montana, New Jersey, Oregon, Vermont, Washington, and Washington, D.C. And it became legal across Canada in 2015. Around the world, it's legal also in Netherlands, Belgium, the UK, Colombia, and Japan. Now, most people that are suicidal are sometimes considered impaired by depression or mental illnesses, and their actions are not considered by choice. That's why they come up with trying to stop patients by providing medical interventions against their will. And I found this on an article called Suicide Attempts in the Terminally Ill. And then the website is mypcnow.org. In 1990, the U.S. Supreme Court determined the Supreme Court determined that people have the right to refuse life-saving medical treatment, and they can designate a healthcare agent to make their choices on their behalf. But then in 1997, the Supreme Court held that terminally ill individuals do not have constitutionally protected rights to have a physician's assistance to die. And then the result of that decision was that individual states get the right to have to permit or ban physician-assisted suicide on a state-by-state basis. And there's the argument for physicians to assist in suicide. The Hippocratic Oath is first do no harm. And so it's considered morally wrong, besides for religious reasons. There's treatment refusal or withholding treatment, and that means letting someone die passively and is justifiable, whereas if a physician assists in the suicide, equates into killing someone and is not justifiable. And certain groups of people might want to do a physician-assisted death. It became somewhat of a cost containment strategy. Sometimes burdened family members and healthcare providers might encourage the option of assisted death. And people were afraid that the poor and those who were afraid of being in pain would kill themselves, and that people who were better off financially or less afraid would live longer and not choose this option. In 1998, there's a study from a medical epidemiologist, Gene Chin, and his colleagues from Oregon Health Division, and it compared the death of 15 people who took lethal doses with 43 who died from their illnesses to find out why some choose to end their lives and why others don't. The main difference between the two groups was that the suicidal group worried more about being bedridden and incompetent. And I found this information on science.org, and the name of the title is Why Some Terminally Ill People Choose Suicide. And everybody has also heard of Robin Williams. He is a world famous comedian. Everybody just loved him. He died in 2014 as a choice of suicide. Now, unlike the topic we're discussing here, Robin took his life by hanging himself using a belt. He had been diagnosed with Parkinson's and previously suffered from anxiety, depression, paranoia, and drug and alcohol addictions. But Parkinson's has no cure or apparent causes, and according to National Parkinson's Foundation, the CDC ranks complications from Parkinson's as the fourth leading cause of death worldwide. And after his death, they did a autopsy on Robin's body, and they discovered that he had actually Lewy body disease in addition to his Parkinson's, and that's caused by an abnormal accumulation of protein inside the brain cells that triggers about 15% of the world's dementia cases. And as more of these cell bodies form, the nerve cells become dysfunctional and eventually die. So you can see what Robin was up against. He didn't want to lose his faculties, his way of life. There was some other article I saw from NBC News that said that he actually even sold a house because he thought he was going to be having some financial troubles due to his disease and not being able to make any more movies. I once cared for someone that attempted suicide, and then when I was looking through their medical paperwork, it said suicidal ideation, which sounds like they enjoy the thought of suicide, but I'm sure that's not really what it should be. Strictly speaking, this means wanting to take your own life or even thinking about suicide. So this was found on suicide attempts in the terminally ill in the Palliative Care Network of Wisconsin. Now, as far as any other questions, I can't think of anything to let you know about, but I just believe that it should be someone's life that they choose how they want to live their life, and it's not my business to be in their business. Right now, Michigan does not have an assisted suicide law that allows for it. So I find it interesting that we don't, considering there's so many other forward-thinking states, and I thought Michigan was one of them, but it's not. And other than that, that's all I can really tell you today, is that I just feel like it should be someone's choice to decide how they wish to live their life and end their life. And death with dignity is an important thing to have for people that are terminally ill. Thank you.